So thank you indeed, Alex. Another person who's interested in modeling because of his professional interest as a health economist is Martin Hensher. So Martin Hensher is an associate professor in health system financing and organization at Deakin University. His research interests include applying ecological economics to health and healthcare, translating economic evaluation into actionable health system policies, and sustainable healthcare in the Anthropocene. So Martin, welcome. Nice to work with you again. Please, the floor is yours.
Thank you very much, Jeffrey. And again, just check you can see the slides okay?
Indeed.
Fantastic. So I'd also quickly like to acknowledge the Wurundjeri people of the Kulin Nation, whose lands I'm speaking to you from. So I've spent most of my adult life either as an economist or around economists. And for about 150 years, we've had a fairly standard way of thinking about what is the economy and what is economics. And economics has typically been defined something like this. Economics is the study of the allocation of scarce resources among unlimited wants. And in this period where neoclassical economics has dominated, economists have thought about the relationship between the economy and the natural world in a fairly straightforward way. Economists clearly recognize that the natural world is essential. It's where our food comes from. It's where all of our natural resources come from. And increasingly, as the years have passed, we've recognized that we can do damage to the natural world as well through pollution, etc. But throughout this time, we've really always conceptualized the ecosystem or nature as really actually being a subsector of the economy. We literally call it the natural resources sector. And in the 70s, a couple of really quite visionary economists, Nicholas Georgescu-Roegen and one of his students, Herman Daly, had the pretty blinding but truly original insight that maybe this was the wrong way round. Maybe in fact, the economy, in this diagram, the little yellow economy, is actually a subsector of the ecosystem. And that proceeds from the pretty obvious thought that if there's no ecosystem, clearly there's no economy, whereas you definitely had an ecosystem before there was a human economy. And they started to develop these concepts. And for a long time, the economy, the human economy, was really quite a small part of the ecosystem. When humanity lived in what Herman Daly's called an empty world. But then in the last 200 years or so, we've seen this extraordinary explosion of economic growth, as we call it now, but really human activity, human economic activity, production, consumption, output, use of the natural world as humanity has moved out and filled up the world with our production, our artifacts, our livestock, ourselves. And it's really essential also to recognize that during that period, that this pulse of economic growth, that has also driven the extraordinary improvements in human health and well-being that we see today. So we really need to remember that the kind of standards of health that we now enjoy, particularly in the rich world, are intimately linked with economic growth. But over time, and particularly more and more visibly over recent decades, it's become clearer and clearer that we're now really living in what Daly calls a full world. The human economy, our activity, has started to occupy more and more space in that ecosystem, to the point that, depending on how you measure it, by many estimates, rich countries, and Australia is clearly one of the worst offenders, on many dimensions, maybe now exceed our safe planetary boundaries on many different dimensions of the natural environment. So in working through the implications of this, Daly in particular, and many people who've come after him, have developed an idea of a new kind of economics, which is called ecological economics. And ecological economics requires us to look at three aspects of the economy. Remember, kind of conventional economics looks at the optimal allocation of resources, efficient allocation. Clearly, we still need to do that. But ecological economics also says we have also to consider the just distribution of income and resources and the sustainable scale of the economy relative to the ecosystem. And one of the big insights of ecological economics is that currently conventional economics just literally does not have tools to conceptualize whether our economy is too big for our planet. And out of these ideas also has come the concept, and I think increasing evidence, that economic growth has over time started to move from bringing us benefits to actually bringing us harms. And over time, the marginal benefits of each dollar of economic growth, each ton of additional output, have started to be outweighed by the harms that increasing economic output and growth is bringing, which has led to the idea that we may be now beginning to live in a period of what's called uneconomic growth. We're still growing the economy, we're making more stuff and we're making it bigger, but actually the benefits we're getting are smaller and smaller, and the harms are clearly becoming bigger and bigger. So what has this got to do with health? Well, health is an important subsector of the economy. And if it's part of the economy, it's obviously also part of the ecosystem. And in particular, we've actually known for a long time that in health and healthcare, we often see diminishing marginal returns. So it's increasingly well understood that if we look at life expectancy, for example, around the world, increasing income, increasing GDP in the poorest countries rapidly leads to big increases in life expectancy. But once you get up into the rich nations, adding dollars to GDP, growing the economy further, really doesn't seem to add much at all to life expectancy. Similarly, in healthcare, since the 80s and Donna Bedian's work, it's been clear that we see diminishing marginal returns to increased healthcare activity at the level of individual patients, at the level of systems, and even globally. And some of the work I've been doing is looking at the global situation. These graphs show you expenditure by country, healthcare expenditure by country against the metric of health-adjusted life expectancy, trying to look at, is there evidence of diminishing marginal returns here? And the short answer is, yes, there clearly is. As we increase spending on healthcare in the poorest nations, we get massive improvements in health. Yet above a certain level, in actually relatively low levels of income globally, those gains start to slow down. And then once we're up to where high income countries are on health spending, we see little or no improvement for additional health expenditure, and a whisper, depending on the statistics we're using, that maybe even at the highest levels of health expenditure, actually health outcomes are worse than at lower levels of expenditure. So really important reason to be thinking about, is health and healthcare wrapped up in this problem of uneconomic growth that I talked about? And it's vital to understand that health, and particularly the healthcare system, are part of this wider system of overconsumption. We see all kinds of overconsumption in the rest of the economy, driving poor health, causing preventable disease, which itself drives what we might call failure demand for healthcare, demand that could have been prevented, whilst within the health sector itself, as Rochelle was explaining clearly, we're stuck in cycles and loops of poor quality care, over-treatment, over-diagnosis, itself driving failure demand for healthcare. And all the while, the healthcare system is causing environmental damage through all kinds of different pathways. So really concluding, my work suggests that I think if we can apply this ecological economics lens to health and healthcare, we can get some quite powerful insights about where we might need to go. And in particular, that we need to be concerned not only with the efficiency of our systems, but what I'd call sufficiency, the scale of our whole healthcare systems. In the world we are today, we are moving into what many have described a post-growth world, where economic growth is slowing and may even need to stop because of the environmental problems I've described. So healthcare is not going to grow in the way that it has in the past. We've already seen that a significant portion of healthcare gives us little or no benefit, and some of it's actually harmful, and all the while, the healthcare system is causing harm to the natural environment. Yet, billions of people around the world have nowhere near adequate access to basic healthcare, while many in the rich world are quite possibly getting more healthcare than is actually good for them. And we're going to have to move, as many others have said already, our healthcare systems have to minimize environmental harms in everything they're doing and minimize their harms to human health. And I think this requires us to make a really big cultural change in healthcare, which I think requires a move to a culture of sufficiency, which I'd summarize really as saying, moving from the past model of do everything possible to something quite different, which is to do enough and to do it well. Thank you.
Martin, thank you very much. That was very nice. I hope that your message gets across not just to fellow health sector thought leaders, but also to mainstream economics. Martin, I think you should have a keynote in some big US and European normal non-health economics settings. That message needs to be gotten out.